Welcome to Long Covid Doctor, an educational series for sufferers of Long Covid. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, now GP lead for 3 NHS Long Covid clinics and a GP clinical lead in Long Covid across the southwest of England. This episode is on hair loss and Long Covid. I talk about the symptoms, the diagnoses and causes of hair loss. Check out the references, resources and links to social media in the show notes below. Just to say, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own doctor or medically qualified health professional. And so here we go. Hair loss and Long Covid. Hair loss in Long Covid is becoming less common, thankfully. Over the first year or so of the pandemic, with the high numbers of acute Covid infection, hair loss was often mentioned, along with all the other initial symptoms of Covid. In our Long Covid clinics, we heard about hair loss from our patients. The hair loss that patients describe is diffuse over the whole scalp, but frequently most noticeably with either side of the hairline. Loss is normally not more than sort of 50% of the scalp hair. Clumps of hair can be pulled out from the sort of the top, the crown, as well as the vertex. As well as the margins of the scalp, so the edges of the forehead. Hair loss will be especially noticed in the bath or the shower tray after hair washing. Often patients report rather alarmingly that it's just dropping out. But, as I said, we are hearing less about hair loss now in our clinics, in the Long Covid clinics. And this is probably due to a number of reasons. Perhaps it's due to the other symptoms of Long Covid being more troublesome and patients considering hair loss to be less important compared with all those other symptoms. Perhaps it's because the initial variants of Covid were more aggressive and more prone to hair loss. And so perhaps the more recent variants are less likely to lead to hair loss, and I certainly hope that this is the case. Perhaps even the overall psychological impact of the pandemic that would also be a factor in hair loss, having eased with time, has meant that it really is less common. Nevertheless, as Covid illness is still with us, it is likely that at least some patients will have hair thinning, hair loss going forwards, and hence adding to all their other Long Covid symptoms, and hence being reported to us in our Long Covid clinics. Hair thinning and hair loss has a medical label, and it is telogen effluvium. Very fancy, probably from the Latin. This is a fancy medical term that defines it, and that the definition really is it is a non-scarring diffuse hair loss from the scalp. So there we are. But before I go into this in greater detail, I think I need to explain in brief about hair growth and what is normal physiological hair and hair growth. What is it all about? And so here we go. Hair is made up of a living follicle, in inverted commas, a living follicle under the skin, and the dead strand of hair that we see, feel, and maybe even enjoy. Hair follicles make hair, and they are regulated by hormones. So that hair growth is regulated by hormones, neuropeptides, i.e. peptides or proteins circulating in the nerve tissue and in the brain, and also immune cells. There are 3 stages of hair growth: the anagen, growing phase, the catagen, resting phase, slowing phase, and finally the telogen, the resting phase. So anagen phase, that's growing, catagen slowing, and telogen phase, resting phase. So each individual hair follicle, and there are lots on the head, goes through this cycle over and over and over again. And each cycle lasts about 6 months. But we don't notice these cycles because all the hair follicles are cycling at different times. And at any one time, some are growing, some are resting, some are slowing down, some are resting. And so overall, our head of hair seems to be growing continuously without obviously showing any resting phase. However, if there is an event that hits all the hair follicles at the same time, it can cause them to be put into the telogen resting phase, the telogen phase, which lasts about 3 months. And this is when our patients are getting their hair thinning, their hair loss, which, as I said, is called this fancy name, telogen effluvium. But it is well known, even before COVID, and hence Long Covid came along, that hair loss is caused by stressors such as illness, particularly severe viral illness, psychological trauma, malnutrition, and various medications, not just chemotherapy. In the acute COVID infection, we know that there are high levels of pro-inflammatory cytokines. These are the chemicals that circulate and sort of generate inflammation, leading to the pro-inflammatory state. And we remember the cytokine storm. And also theoretical microclots, which is part of the inflammatory process in the skin, impairing the blood supply to the hair follicles. This process may also contribute to the sort of the inflammatory response and attack on the hair follicles. However, as we also know, during the acute COVID illness, not only is there the effect of the virus, there's also the psychological impact of living through a pandemic. And those, let's face it, were really worrying times. And so hair loss following acute COVID could be due to a combination of these effects, of both these stressors, i.e. the physiological as well as the psychological stressors. The treatment, therefore, and obviously for hair loss, is correction of those underlying causes, as well as the removal of the precipitating stressors. So, focusing on the latter, the stressors following acute COVID, well, hopefully they'll resolve with time. That the inflammatory state that I was just talking about will settle. The psychological effect on our patients, hopefully, will settle. And then the hair follicles will wake up from their resting phase and start to make hair again. And this can all take up to 6 months. That's 6 months, that's a long time. The hair losses following COVID is usually noted at about 3 months after the infection. So this is what our patients are telling us. They don't notice it to begin with, but about 3 months after, that's when they begin to report hair loss. And that's when they begin to see it, in the shower tray or coming out in clumps when they brush their hair. And so, like I said, 3 months before it presents. And so the return of normal hair, the regrowth, is expected at about 9 months after the initial COVID infection. And this is what we tell our patients. This is what we need them to know. To hold on to that hair loss is not permanent. The hair will regrow, but you've got to give it time. And as I said, this is about 9 months from the initial COVID infection. Earlier, I did also mention the importance of correcting underlying causes of hair loss. I'm going to say it again, telogen effluvium. And this is also important. And as always, let's not overlook other causes that can result in hair loss, and not necessarily just blame COVID. Let's not be COVID blind to those other potential causes. And so, what are those other potential causes that can cause hair loss? Well, the commonest non-viral, non-psychological cause of hair loss, causes, I'm going to give you a few, are iron deficiency anemia, over or underactive thyroid gland, zinc deficiency, a autoimmune condition called systemic lupus erythematosus, so SLE for short. Hair dye application can lead to hair loss, and also a number of prescribed medications. It's reported in their side effect list, such as in the oral contraceptive pill, statins, the cholesterol drug, anticonvulsants. Some anticonvulsants can lead to it, and some heart drugs. So we should all be on the lookout for those other causes of hair loss before putting it down to COVID. So a minimum battery of laboratory blood tests should be performed for hair loss to exclude those diagnoses. So your GP will probably send bloods for full blood count, looking for anemia, liver and kidney profile, thyroid function test, as I say, over or underactive thyroid can lead to hair loss, serum ferritin just to look for inflammation, but also it's a marker of your iron levels, and also zinc levels. Another blood test is the ANA, the anti-nuclear antibodies, looking for this very rare condition called SLE. So if these tests have revealed subnormal levels of any of those, such as iron or zinc or thyroid hormone, obviously supplementation, treatment of those conditions will aid hair regrowth. Various medications have been studied for possible hair growth stimulation, and beta blockers have been tried, retinoids, anticoagulants, and antithyroid drugs, but none have demonstrated any significant effect. There's also the topical minoxidil that you may have heard of or read about. This has been shown to stimulate hair growth and effectively, but unfortunately its effect only lasts while it is used. So as soon as you stop using it, as soon as you stop applying that lotion, the hairs start falling out again. Minoxidil lotion is only obtainable off license as a private prescription, the cost of which most patients find really expensive. But, actually more importantly, just to remember that, that if you want to use this to restore hair growth, actually incidentally the hair growth is not sort of, your usual coarse normal hair that you're used to. It's usually quite fine. But if you do choose to use minoxidil, you're going to have to use it indefinitely. Like I said, it's expensive. And so, what it all comes down to is this. The most important aspect of managing long COVID hair loss is an explanation, an understanding and reassurance for the patient. The message that we need to get over is this. Once the actual COVID infection has passed, the trigger factor that's caused the injury to the hair follicles, that is, that will have passed. The actual trigger factor will have passed. This, if you like, date stamps the expected return of hair growth. And this should occur approximately 9 months after the initial infection. So remember what I said. Hair stops growing and starts to fall out at about 3 months after the infection. Hair starts growing again about 6 months after that. And so, as I said, that adds up to a total of 9 months following the acute infection. Understanding this process, the natural history of the condition, and reassurance that hair growth will restart, also addresses the psychological stress factor of hair loss that is probably contributing to hair loss. Hopefully, the overall stress caused by the whole COVID experience will have improved greatly also. And so, overall, with the understanding of the hair thinning, the hair loss process, and the reassurance that the hair will regrow, will be a great help and comfort for our patients with this worrying condition. And all this will also be further helped by the general, more holistic advice I always give, namely attention to nutrition, attention to sleep, and attention to mind-body state. So, briefly, all of these in turn. What do I mean by this? Nutrition, well, that mixed, balanced diet, preferably the Mediterranean diet, that provides all the vitamins and minerals necessary for cell tissue repair. And then sleep, a healthy night's sleep, that's supportive of the day-night circadian rhythm, the day-night cycle, circadian rhythm, as we know. Body restore and repair happens when we sleep. And finally, mind-body state. What do I mean by this and what are we talking about? Basically, it's tackling the excess adrenaline fight-flight response. We should be considering practices like mindfulness and yoga to help with this process of dampening down this excess adrenaline drive. Their effectiveness is backed up by respectable research studies. All these measures are really important in the general recovery from long COVID, and that includes this topic also, the regrowth of hair that has thinned and fallen out since acute COVID. As I said earlier, thankfully, We are seeing less of this now in our clinics. However, I don't doubt that it is still probably affecting some of our long COVID patients, knowing that COVID is still out there, still circulating, and therefore leading to further cases of long COVID. And so, that concludes my talk on hair loss and long COVID. I hope you found that helpful. Check out all the references and resources and the links to social media in the show notes below. As always, my usual disclaimer: any advice, diagnoses, treatments that I mention should only be considered after discussion with your own doctor or medically qualified health professional. In the meantime, I wish you well. I wish you well in your long COVID recovery. Cheerio.